Hello, everyone. We'll get started shortly. Thank you for joining us for our Wellness Wednesday today. And we'll get started in about 4 minutes. Hi, Stephen. It's nice to see you again. It's been a while. You got a longer beard, I think, than the last time I saw you. Looks good.
Yeah, I've been letting it grow.
Well, we appreciate you being here.
Need to go on mute for my clocks.
All right, everyone, we're going to get started in about 3 minutes.
All right, everyone. Hello. Thanks for being here. We really appreciate your time. My name is Angel. I'm the current health program coordinator, and welcome to Wellness Wednesday. We're also joined by Samantha, as I'm sure most of you know. She's the health and fitness program manager here, excuse me. So today we're going to be talking about how to prevent falls in and around your home. If everyone's ready, we'll get started. Just want to reiterate to everyone that we are recording this session. If any of you have any concerns or feel uncomfortable with this, you can go ahead and turn off your camera, as this will be posted to our YouTube channel, the website, and our Facebook page. Alrighty, so this is our mission statement. So we are Healthy Aging Association, a 501c3 nonprofit. Our mission is, as a nonprofit organization, is to help older Americans live longer, healthier, more independent lives by promoting increased physical activity, sound health, and nutrition practices. So first, we'd like to start with some statistics. Falls are the leading cause of accidental death in older adults. Recently, it has been found that 1 in 4 older adults have ended up on the ground due to a fall since the start of the pandemic. Approximately each year, 3 million older adults are treated in emergency departments for fall injuries. This has led to find that most falls lead to traumatic brain injuries. And because of these injuries, over 800,000 patients are hospitalized every year to treat these head injuries or even hip fractures. So what can happen after a fall? Falls can cause broken bones, most commonly a broken wrist, arms, ankles, and even hip fractures, like mentioned before. Falls can cause head injuries, like the previous slide has said. You should seek out a doctor right away if you have fallen and hit your head or unsure if you did or not. If you're on blood thinners, you should definitely seek a doctor as things can become very serious very quickly. Many people who fall, even if they're not injured, become afraid of falling in the future. This can lead to an association with certain physical activities. You may become scared to do these activities because you're scared to fall. This is normal and it can be remedied with certain measures.
All right, so I would just like to say that most falls occur inside or close to your home. And so what we're really talking about today is how to make your home safe. During this pandemic, we're spending a lot more time at home. Look at me, I'm at home, but it happens. And so how can we prevent the falls in our home, especially where that's where falls typically happen even before the pandemic, when we're out doing things and out and about. Most falls still occurred in the home. So here are some tips from our Dignity at Home Fall Prevention Program that you can do to make your home safer. So I love for the three of you, which I know you all very well, the three of you, we've all done programs together over the years, but I would love for you to unmute yourself if you feel comfortable and tell me, what hazards do you see in these pictures? Anybody? Anyone want to take a stab at it? You'll just unmute yourself. Don't be shy.
Clutter.
More clutter.
Clutter, yes. Yes. What else do you see? Within the clutter, what do you see?
That rug right there is a real tripping hazard.
That rug? Mm-hmm.
In the bedroom?
In the bedroom? Especially because it's not even flat, is it?
No, it's not. It's on its corner.
Yeah.
Skateboard in the living room.
Well, maybe your grandkid came over and left their skateboard just sitting by the couch.
Mm-hmm.
That is a bathroom. So what you see there to the right of the cabinets is some storage units and what may be a laundry basket. And to the right of that is a toilet. So we see a lot of hazards here. We'll kind of dive into a little bit more about these hazards as we go on to the next few slides. So here we go. So as you just saw, those are some things that we don't want to do. We want to keep our pathways clear and clutter-free. So especially if you have stairs, very important to make sure that they're nice and clear, but your walkways too. You want to make sure that you can walk with ease wherever you are going so you don't trip over any objects. Ensure that the furniture around you is sturdy and stable in case you lose your balance. So we did see a lot of storage bins stacked up. If I get wobbly and lose my balance, are those storage bins nice and sturdy? Probably not. They're probably coming down with me if I fall. Add storage for those things that are usually on the floor. So maybe your shoes, maybe you just need a storage unit for your shoes by the door or somewhere to organize papers instead of loosely among your house. Make your home safe by lighting your way. Install bright lights. The idea would be to have switches at both ends of your stairs and walkways, but sometimes that's not always the case. So you want to make sure that you have night lights to light the path from your bed to your bathroom, so you don't even have to turn on a switch. Now, if you do want to turn on a switch, those night lights should help your switches be a little bit more brighter and might glow a little bit for you. Have night lights throughout your entire home. So maybe you need to get up in the middle of the night to go get a drink of water or something like that. You want to make sure that you could walk with ease from one place to another without turning on any light switches. And then make sure you have a plan for lights in case of a power outage. Do you have a lantern or flashlight near your bed? So if the light power did go out, that you could get from one place to another safely. Especially if you rely on maybe the light from outside your home, maybe there's a street light. If you rely on that, you want to make sure that you have a plan in place in case that was not there. Add supports in the bathroom. So bathrooms can be dangerous as they are meant to get wet. Put grab bars near toilets and showers, and then make sure you have those non-skid strips in the bathtub to keep you from slipping. If you have stairs maybe leading up to your house or within your house, consider installing handrails on both sides. If you already have handrails, you want to make sure that they are sturdy, that if you put your hand on them and wiggle them, that they are not moving, that they are nice and secure, and they will stabilize you, especially if you trip and lean into it, right? And you want to make sure that it's there for those scary moments as well. And finally, be aware of those uneven surfaces. So you guys saw those throw rugs. I will say that in our program, our Dignity at Home program, we have seen some homes that have an abundance of throw rugs. Especially those small throw rugs could be a concern. So look out for changes in level of flooring, such as doorways or in between carpet and tile. Especially make sure that when you go into a new environment, like a hotel room or a friend's house, that you are making, that you are checking your environment before you proceed too far. Remove those throw rugs, especially if they're small. If you can just barely move your foot along the rug and it curls up, that is not safe. If you must keep those larger rugs, use a rug gripper underneath to secure them to the floor. If you can move a rug easily with your foot, you can slip on it. Got it? Want you all safe. I care about all three of you. So let's make sure that your house is as safe as possible. So what you can do is you can complete a home safety checklist. This checklist will go through your entire home to ensure all rooms are as safe as possible for you. If you mark something that is unsafe, there are recommendations on how to improve your safety. You can either email us, you can give us a call, or you can visit our website if you have the ability to download it and print a copy for yourself. And we're going to go into more details on how you can get a home assessment done within your home.
So what Healthy Aging Association offers to help reduce falls? We have a few different programs. The first one, Dignity at Home. It's a fall prevention program that Sam was just mentioning. We have the class, A Matter of Balance. We have Young at Heart Strength Training, a fall prevention program as well. Tai Chi for arthritis and fall prevention, and Young at Heart Steps. I will go into each one a little bit more. So Dignity at Home Fall Prevention Program provides in-home environmental assessments, fall prevention education, and injury prevention accessories to qualifying individuals. So these different things that we offer are all just there to either help you stay safer in your home or like on your own independently, or we can come in, provide injury prevention accessories that can just make you a little bit more safer when they're needed. So Dignity at Home Fall Prevention Program, we offer things like grab bars, toilet seat frames or rails. We offer shower chairs. We offer non-slip bath mats, things like that. So in this picture on the left, or my left, maybe your right, the before picture, there's obviously a lot of clutter in the bathtub, lots of different things going on. There's some room for improvement there. So in the after picture, you can see that we installed a handheld shower head to make it easier for you to shower. You don't need to use a cup or anything like that in the shower. No heavy lifting, no bending over, stuff like that. You can just bring it right down to you. We gave a shower chair. So if you are standing in the shower and you feel a little wobbly, or you get dizzy, or whatever the case, or feel it's best to sit when you wash your hair and there's soap everywhere, you can take a seat. There's a grab bar there now as well, additional to the one that's already in the middle, but this just helps. It's sturdier, it's bigger, so you have more access to it. And then we see the toilet seat frame there, helps you get maybe onto the toilet, off the toilet. You can even use it as just to hold on to, say, if you're moving around the bathroom, just to get around the toilet or something of the sort. Next, we have fall prevention guidelines for the program Dignity at Home. You must be at least 60 years of age or disabled, at a risk for falling, or have had a fall recent, fully vaccinated from COVID-19, and also must meet income guidelines. Program guidelines. To get started, you can call the senior information line. Number is listed there, 558-8698, for initial pre-screening. They'll get you over to us if you pass the pre-screening. If not, I'm sure the senior information line can offer you some other programs or help that you may be able to use. If you do decide to call and you get over to us, it'll be me, the health program coordinator, who will contact you and move forward with the process. A Matter of Balance is an evidence-based program designed to reduce the fear of falling and increase the activity level of older adults who have concerns about falling. It's 8 2-hour sessions with small group discussion. So depending how many people are in your class at the time, you guys will all be able to, you will all be given time to facilitate conversation, so you guys can see things at a different perspective, or maybe get new ideas. They'll teach you how to view falls and get comfortable with the fear of falling. It's a normal emotion. Set realistic goals for increasing activity, learn to change their environment to reduce falls, and then simple exercises to increase strength and balance. Next, we have the Young at Heart Strength Training, which is a practice tested intervention. We use rubber resistance tubing with soft handles. There's 4 different levels of resistance. You can go up and down depending on your strength at the time, or improve strength later on. Let's see, each class is 1 hour long, meeting 2 to 3 times a week, depending on the course. We have Zoom classes currently, and we also have in-person classes. In these courses, you just work on your strength, your balance, your flexibility, helps reduce overall the risk of falling, and helps you maintain your independence, which is very important. Next, we have the Tai Chi for arthritis and fall prevention. Tai Chi for arthritis and fall prevention works through improving balance, confidence, and muscular strength. The class is currently being offered Tuesdays and Thursday mornings. The one thing with this class is you will need proof of COVID-19 vaccination. If you have any questions, you can always give us a call and we can walk you through it. Next, we have Young at Heart Steps, which is a senior tracking exercise in perfect strides. So there are 2 different challenges throughout the year, one in the fall and one in the spring. The dates are listed specifically for this year, and the next one coming in spring of 2022. The registered walkers in this program receive weekly motivational emails. They report miles to Healthy Aging Association every 4 weeks. Reported miles qualify you for an entry into a raffle. You also get invited to a celebration with brunch and things like that, which is a good old time as well. At the conclusion of each challenge, we bring all registered walkers together for a drive-through brunch, and their raffle happens and things like that. So in summary, here are some tips for preventing falls. Like Sam mentioned earlier, lots of clutter can put you at risk of falling. So just try to keep your pathways clear and clutter free. Light your way. Small night lights are good. You don't need a huge lamp, anything like that. Just into the little accessible wall ports in your hallways, or one in the kitchen, one in the bathroom, just so it lights up a little bit more of your home, so you don't need to turn on the light switch. Or if you're struggling to get to a light switch, you have the light already there for you. Add supports in the bathroom. Sometimes bathrooms can be very slippery. Just adding support here and there is good. You don't need to use them all the time if you don't need to, but they're there when you do. Stay safe on the stairs. It's important to wear good shoes, hold on to the handrails. If they're there, why not use them? And then just be aware of uneven surfaces. Throw rugs are typically pretty slippery. Sometimes they could even be dangerous in areas like bathrooms and in tile kitchens and things like that. So yeah, try to get rid of those throw rugs. Also, prevent falls. You can get your hearing and your vision checked annually, every 6 months, whatever works for you. But as long as you try to keep up with it so that you are at your best all the time. Use your assistive devices, excuse me. If you have a walker, if you utilize some sort of assistive device, make sure you use them. They're there to help you, not to hinder you in any way. Hopefully they aren't. Watch out for your pets. Pets can be lovable sometimes, overly lovable, and they just want to be around you all the time. Just try to look out for them before you take your first step, or if you're going to step back or something like that. Just check if they're there so that you don't have any additional risk of falling. Be careful outdoors. Uneven pavement in the street, driveways sometimes are at a slope, and that could be dangerous. And exercise regularly if you can. We have tons of different courses and classes offered in different communities and different settings that can help you maintain your strength and balance and your independence. So next Wednesday, our next Wellness Wednesday is September 29th at 11 a.m. On Zoom from the comfort of your own home. You don't have to go anywhere. You can just log in. You can stay in bed. You can have your tea or coffee, things like that. We'll be discussing assistive devices and how they relate to falls. So again, like I mentioned earlier, use your assistive device if you can, if you have one. If you need one, contact us at Dignity at Home and maybe we can help you or get you some information to get you one. We will have guest speaker, Dr. Bob McGrew. I'm not sure if you guys have met him yet, but he will be there and he has some expert doctor advice, okay? Let's see. Does anybody have any questions, any comments, concerns, things of that sort? No questions, no comments. You guys like the information we provided? Would you guys like any more information that I can offer?
You covered a lot.
I'm sorry, we can go back to some of it if you like. Any specific questions?
No, it sounds good. You covered a lot.
Alrighty. Matilde, Stephen, how do you both feel? Good.
I'm good. Most information is pretty current.
Yeah, our information is current. This is what we are currently offering. Again, we have a lot of different things. So if you ever do get confused, just give us a call or maybe you can send us an email. We can give you a detailed rundown.
Angel, I'm actually in Merced County, not the Stanislaus. Does that make a difference?
Some of our programs do require you to be in Stanislaus County. I live in Merced County too, so but yeah, some of
Oh,
them
good.
are specifically for this county, and San Joaquin County for some of them.
Well, thank you everyone for your time today. We appreciate it, and we look forward to seeing you soon and at our next Wellness Wednesday. Thank you, everybody.
Thank you, Samantha.
Thank you.
Angel.
Bye-bye. Thank you, Angel.
Bye.